Okay, so welcome to this video in which we are going to introduce atherosclerosis, and this is the first video in the playlist on cardiovascular pathology. Okay, so atherosclerosis is the topic for this video. Now, before we can talk about what atherosclerosis is, we need to make sure that we all know the different layers of the blood vessel very well so that we can then go on to discuss atherosclerosis. Okay, so let's start with a revision about the layers of a blood vessel. So let's say we have a picture of a blood vessel here. Okay, so this is our blood vessel. Right, so at the center you have the lumen, which has the blood moving through it. So this here, right at the center, this is the lumen of the blood vessel. Okay, then surrounding the lumen of the blood vessel you have a layer of endothelial cells, which I'll draw like so. Okay, so these surround the lumen here. So I'll give them all nuclei. Okay, and the endothelial cells are all sitting on a basement membrane made of collagen. Okay, so I'll show that in this turquoise color here. So, around the endothelial cells is a tiny little thin layer of collagen which they are sitting on, known as the basement membrane, okay? Right, so this piece of collagen here, this is the basement membrane. Now, underneath the basement membrane, there is more connective tissue, which is known as the subendothelial connective tissue, basically. Okay, right, so where shall I show this? How am I going to do this? Right, so I'll put another little layer around like this. Okay. And I'll colour this in orange. Right, so this orange layer in here, this is more connective tissue basically, that generally will be collagen again, which makes up this layer between the endothelial cells and the next layer around the blood vessel. So this is a layer known as the subendothelial connective tissue, or just the subendothelium, you will occasionally hear people call this. So this is the subendothelial connective tissue. Okay, and then surrounding the subendothelial connective tissue is a layer which I'll show in blue. So here in blue, is the internal elastic lamina. Okay, and this, as the name suggests, is mainly made of elastin. So this in blue is what's known as the internal elastic lamina. And now finally, the internal elastic lamina demarcates where the first layer of the blood vessel ends. So this is the internal elastic lamina. Okay, so all of these layers that I've talked about so far, the layer of endothelial cells, the basement membrane, the subendothelial connective tissue, and the internal elastic lamina, this is all what is referred to as tunica intima. Tunica means layer, okay? Intima means close. So this name means the layer that is close to the blood. So the blood is flowing through this lumen here, okay? Right, so that's the origin of that name, tunica intima. Now, all of those structures that I've described there are what are the tunica intima. And atherosclerosis, as we're going to see, is a disease involving the tunica intima. Right, okay, so then the next layer of the blood vessel is going to be the start of the tunica media. Okay, now the tunica media, the tunica media is made up of smooth muscle cells, vascular smooth muscle cells. So let me draw some vascular smooth muscle cells here. So these are long, elongated cells which are arranged in circles basically around the lumen of the blood vessel. So these are these circles of vascular smooth muscle cells surrounding the lumen of the blood vessel. Okay, so here's another one here, and then a final one there. Okay, so these are all vascular smooth muscle cells. So let me colour these in red. Okay, so that's a vascular smooth muscle cell. Here's another vascular smooth muscle cell. Here's another vascular smooth muscle cell, and another one, and another one, and continue on, colouring them in nice and red. Okay, so these are all the vascular smooth muscle cells. Now, let me just label them up. So the vascular smooth muscle cells are connected in these circles which surround the lumen of the blood vessel. Vascular smooth muscle cells. Okay, and when these vascular smooth muscle cells contract, their whole cell is going to contract, and you can imagine that that's going to decrease the length of these vascular smooth muscle cells. Now, if all of the vascular smooth muscle cells that are connected together to make this ring of smooth muscle cells decrease in length, then that means the circumference of this ring of smooth muscle cells is going to decrease. And if the circumference decreases, the diameter is going to decrease, because the diameter and the circumference are linearly related by pi, basically, by a factor of pi. Okay, so the diameter will decrease, and if the diameter of this smooth muscle ring decreases, it's going to mean that that's transferred to these inner layers, and eventually what's going to happen is the lumen is going to decrease. So they control the size of the lumen of the blood vessel. Okay, now this entire layer of vascular smooth muscle cells, this is known as tunica media. Okay, so tunica again means layer, media means the middle layer, so this is the middle layer here. Okay, and then surrounding the tunica media, you have another layer of elastic tissue. So again, I'll colour this in blue. Okay, so this layer of elastic tissue that's outside of the tunica media. So the tunica media sits in between these two layers of elastic tissue shown in blue. And this basically is the external elastic lamina. Again, made of elastin. Okay, so external elastic lamina. Okay, and then outside of the external elastic lamina, you then have the final layer of the blood vessel, which is known as tunica adventitia. Okay, and I think actually the external elastic lamina will be accounted as part of tunica adventitia. But outside of the external elastic lamina, you have a lot more collagen, basically, which I'll show now in yellow. And this is the connective tissue which basically attaches the blood vessel to other structures in the body. Okay, so this is again connective tissue, collagenous connective tissue generally. Okay, so connective tissue, and this layer consisting, I think, of the external elastic lamina and this layer of external connective tissue, together those are known as tunica, again meaning a layer, and then adventitia. Okay, so this is the structure of a blood vessel then. Right, so what is atherosclerosis? Atherosclerosis is, firstly let's discuss the origin of the name. Athera is a Greek word. The Greek word athera basically means porridge, okay? And sclerosis means hardening. Sclerosis means hardening. So this basically means porridge hardening, okay? And atherosclerosis basically is plaques, large hard plaques in the tunica intima, specifically in this subendothelial connective tissue, but also in the internal elastic lamina. So all of these layers down here, the endothelium, the basement membrane, the subendothelial connective tissue, and the intima, you get huge, great plaques forming in those. Okay, so let's draw an altered inner portion. Let's draw an altered tunica intima. So this time we're doing away with all the outer bits of the blood vessel, and we're just going to draw our tunica intima. So here's our endothelial cells sitting on our basement membrane here. Okay, so here are our endothelial cells, all with their nuclei here. Okay, and then they're sitting on this basement membrane, which I drew in turquoise. Okay, and then underneath that you then have the subendothelial connective tissue, which is this layer of collagen really. Okay, and that's in orange. So this is all subendothelial connective tissue. Okay, and then outside of that you have this internal elastic lamina in blue. And basically what you're going to get is huge disruptions of this. So this is the normal healthy one here, normal healthy tunica intima. What's going to happen is if we redraw this, you're going to get a huge, great plaque forming inside there. So maybe there'll be this sort of huge structure coming out like here. So here are the endothelial cells again. Okay. Somehow they've gone from being only a few to being many. But here are these endothelial cells. Okay. Then you still have this basement membrane. Let's say here that these endothelial cells are sitting on. And basically what's happened is you've now got a huge plaque sitting here. Let's have this large plaque. And we will colour this in yellow here. Okay, so this sort of structure, this mass that is within your subendothelial connective tissue and also within the internal elastic lamina. It affects the internal elastic lamina as well. So here's the subendothelial connective tissue in orange here. Okay, and it's not just a plaque involving the subendothelial connective tissue. The early ones are, but it also involves the internal elastic lamina. And basically you've got this growth, this structure that's sort of taken over these two structures, and it's a large, basically, proliferation of the cells involved in here. And you also have other structures coming in and making this structure, basically. So this is what we will call an atherosclerotic plaque. So this is an atherosclerotic plaque. Okay, and it's called that because it's supposed to resemble porridge, this structure that you've got here. And it also causes the hardening of the artery, because basically, once you've got one of these in your arteries, they can get very hard. So you'll feel hard lumps in your arteries. Rather than your arteries being beautifully squishy and elastic, instead you'll feel these hard lumps in them. So that's where the sclerosis comes from. Another name for this sort of growth here is an atheroma. Okay, so oma means growth or mass. So tumours are usually referred to as omas with the suffix oma. Athero, as we've discussed, means porridge. So this is a porridge looking like tumour, basically. Okay, so atheroma is another name for an atherosclerotic plaque. I should have put there, an atherosclerotic plaque. Okay, now I just want to finally in this video talk about the difference between atherosclerosis and arteriosclerosis. So arteriosclerosis means any sort of disease that causes hardening of the arteries. So this just means that your arteries have hard walls, hard arteries, okay? So when you feel the arteries of someone with arteriosclerosis, they're going to feel hard. Rather than beautifully soft and squishy, they're going to feel hard and solid. Any disease that causes that hardening of the arteries would be referred to as arteriosclerosis. Atherosclerosis basically is an example of a disease that can lead to arteriosclerosis, but it is not the only example. Then finally, one other piece of terminology, arteriolosclerosis, that you may occasionally hear. This means hardening of the arterioles, so hard arterioles specifically. Okay, so arteries are big blood vessels like the aorta, the renal artery, whereas the branches that come off arteries, they're slightly smaller, but they've still got large amounts of smooth muscle around them. And those are called arterioles. Arteriolosclerosis refers to the hardening of those, so the loss of the elasticity of these and the replacement of that elasticity with hard, solid structures, and that refers to arteriolosclerosis. And similarly, atherosclerotic plaques or atheromas within arterioles would be an example, a very, very common example of how you can get arteriolosclerosis.